So for example, if you have a bacteria, so you can have this diarrhea, but diarrhea can be caused by a worm, it can be caused by a parasite, it can be caused by a virus, it can be caused by bacteria. The antibiotic's only going to work for the bacteria. So you have to recognize which condition you're dealing with to know if you use antibiotics. Not because you have a diarrhea, you're just going to take antibiotics and everything's going to be fine. The second thing too, again, like I was saying, you have to use the right antibiotics for the right thing. So how does antibiotic works? Antibiotics have different ways of killing bacteria. And I'll try to find a video or something that kind of shows that. But some of them, what they'll do is basically drill. So for example, if you imagine that you have an organism like this, they have layers around them and stuff. And some of them, what they'll do is that basically drill through those layers, and the bacteria will leak all this fluid and basically die. Some of them, what they'll do is basically decrease their reproduction of it. They have all different mechanics. And when we say about resistance to antibiotics, is what it is that once, sometimes those little microbes, they'll understand the mechanics of how this antibiotic can attack them, and they'll block it. For whatever reason, they become resistant, they understand how it works and stuff, and won't allow it. So for example, if you're drilling about this, it will create a surface that you cannot drill through it, and so they'll develop the resistance to it. So, so this is how antibiotics works, and that we're talking about creams or so per the mouth or intravenous. All those are the same thing. So this is another point what I bring. So when you're using antibiotics or anything like this, or any medication, you basically, there's different forms of it, and it has different effects. And to understand that is really important, because some of them will have what we call first pass. So for example, if you take something per the mouth, it's going to go all through your stomach, and then goes through the livers, and then reproduce, then will be released and everything. So as easy as it is per the mouth, is as cheaper it is for taking medication by the mouth, is actually the less effective way to give medication, because to make it is the hardest way to make it, because you have to go against the acidity of the stomach, that first pass effects and everything, versus this, for example, if I give intravenous, it goes straight into the bloodstream and distributes itself. But then it's a harder way to give it. So there's always pros and cons to everything that you give. So when we're talking about infections, you have to choose the right product to whatever you do. And so there's some disease. So if it's all in your body, then taking per the mouth or IV would be probably the best way. If, for example, I have a wound, I can put a cream on it. And so then it brings us two different categories. So if I have, for example, a wound is infected, I can put just a product right through it, which will have better absorption to the surface and react than if I take it per the mouth. So you have to choose the right category of medication you're doing. But the thing is that if I use product all the time, so for example, polysporin, triple antibiotic ointment and everything, my body, some of this will go a little bit in the blood, and you can have a resistance. So when you truly need it, so that means when your wound is truly infected, that product may not be useful, because now your body is, hey, I know how to resist to this because I've been, every time you scratch your arm or something like this, you have it. So that's why I want to caution people about using those products too much. You have to wait for an infection to use it. Does that mean not to have them, not to carry that? No, because when you truly need it, you need that. But there's other products that you can use for that. So it's really important to understand when to use it and not to use it. And I did a video on that, and I'll put the link under and everything. So to finish this video, basically the points that I wanted to make is that be careful about the products that you want to use, especially in wound care. And most of the time that's what I see, because a lot of people want to put alcohol in there and stuff. You do not need to use those products. Just irrigation will clean pretty much all your wounds, and the literature is out there sufficient to prove it. Just irrigation, you can do it. The other thing too is that, yes, okay, you can stock antibiotics, but you have to know which one and when to use it. And a lot of people, that's pretty much the other part that I'm not quite sure. They're like, oh yeah, I'm having antibiotics all the time, blah, 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 blah. But the thing is when to use it, because if you use it at the wrong time for the wrong disease, your body will become, and right now it is a big issue. Resistance to antibiotics is because we've been abusing of them, and they have a place, but you need to know when to use this place. I mean, there's a lot of conditions that, for example, if you look on the First World War versus the Second World War and the invention of penicillin, there was a lot of conditions that people would die on wounds, just because of wounds. Like, I mean, amputation during the Civil Wars, where they literally would just ampute yourself, that now you just put an antibiotics on it and that's it. And in the 1800s, when Listerine was doing his research and everything, was using some products to decrease that use because he didn't have the antibiotics and stuff like this. But so they are important, they are useful, but recognize that they have their limits. You have to know when to use it and how to use it. So for some conditions, so for example, if I have a wound that is external, I don't need to go full-blown infection unless I have certain signs, and that's where the nerds and stones helped. But unless I have this, don't need to go fully metabolics with the metabolites on your metabolism to take the pills, put them out. You can go just with a cream, and that would be good. And that's where your triple ointment can help and everything. But only, again, only if you have signs of infection. If you put that kind of stuff all the time to every wound you have, there's a good chance, and almost a sure chance, that when you truly need it, it won't be useful. It won't be effective because now you took off the part that is good. So use them wisely. Know when, which one, and how to use it, because there's different things, and that's why in the triple antibiotic ointment there's 3 different antibiotics because of the increase of chance of stuff like this. So have them in the kit, but know when to use it too. And otherwise, all the other conditions, learn more about the conditions and stuff and when to use antibiotics. We'll do another videos on the medication list that I will recommend and stuff like this based on what I'm reading and everything, and again, if I have the multi-purpose and stuff like this. So, so that was a little video I wanted to do on antibiotics and products that are mostly used, so the antiseptics and everything, and I'll put a link as well on the different definition, because a lot of people are kind of confused in it, but hopefully that was helpful.